What's up, everybody? Welcome back to the Move Better channel. I'm your host, Dr. Joe, and this is the Professor John Penisarada. Today, we're going to be talking to you guys about tension headaches, where it comes from, and how to fix them. So tension headaches, where do they start from? So tension headaches are a very specific type of tension. A lot of the time we say cervicogenic, which is a problem with tension of the traps, the shoulders, the neck, the mid-back over here, and then it travels all the way up, and then you have this pain in the back part of your neck or the back side of the occipital area, and then it goes all the way up, and sometimes you have it in the front part of your head because all of that chain, the chain stemming all the way from your feet actually goes all the way up to the head, and it controls your postural muscles. And sometimes the postural muscles get deficient and they get lazy because you're probably not doing enough, or you're probably not moving enough to keep your posture upright. That's right. And so one of the things that we want to do is help you fix that today. And so John has a list of exercises that he's going to lead us through today and get you guys right.
One of the things about tension headaches is that it is affected by the posterior chain. We've always talked about that in our channel here. Posterior chain is basically from the back of the heel, or even from the bottom of the foot all the way to the front of the head right here. There's a fascial line that actually works in unison or in a collective manner to help with our posture. And we were just talking about where you might feel the tension back here. It's because we need to mobilize or activate some of the posterior chain. So we got 3 exercises here. I want to give a shout out to the folks at Egoscue, my boy Pain Free with Oscar. I learned this from him. And these 3 exercises will help you with releasing some of that tension. First thing you want to do is you want to get in a chair where you can actually get yourself seated at a right angle at the hips and at the knees. And then you're going to need a strap, yoga strap, or a belt. Nothing elastic. If it's elastic, it actually doesn't work as well. So we got a little strap right here. And what we want Dr. Joe to do is he's going to get his knees, hip, knees, and ankles lined up. And you want about 2 fists away in between your legs and make sure he's lined up. All right? We're going to take the belt and we're going to wrap it around both of the thighs, just like that. Okay? So if it's a yoga belt, it's a lot easier to use. Or if it's a regular belt that you have. So you want it tight so that the belt has tension throughout the whole time. So we got about 2 fists away from between the thighs. We got hip, knee, ankle lined up. And then you want an anterior pelvic tilt. So you got your pelvis right here. You want to rotate it forward, which enhances his lower back arch. Okay? So now if you see him, if I'm looking at Dr. Joe from the side view, he's actually seated upright really high. Okay, just like so. Okay, got that lower back curvature. From here, he's going to keep tension on the belt the whole time. All right, and he's going to do pulsing movements with his legs, where he's going to press against the belt and then just release it for a second and then press again. Go ahead and put your hands, palms up like this. Relax the upper body, relax everything. Anterior pelvic tilt. Now he's going to press the belt and release. Press the belt, release. Okay. Use about 30 to 50% of your strength. You don't have to go maximize on it. Okay. And as he's pressing, always remember to keep that anterior pelvic tilt. A lot of times, because of the movement pattern that we've created for ourselves, we start to slouch. But if we have that anterior pelvic tilt, you're going to keep that posture up. Now, what you're doing here is we're activating his posterior part of his hip muscles, trying to get that hip to be active and be even, okay? And one of the things that you also want to do is you want to cognitively make sure you're pressing evenly with both legs, okay? A lot of times, if you're dominant on one side, you'll actually start pushing or pressing with more pressure on one side. So you want to make sure it's even. Okay, I would say do about 40 to 60 of these per set, or excuse me, one set of 40 to 60 repetitions. Or if you want to break it down, you can go 20 repetitions 3 times to get those hip muscles activated. Exercise number 2, we still got the same strap. This is all you're going to need. All right, now we're going to activate the lower part of our posterior chain. So what we're going to do here is in the same position, you still got your anterior pelvic tilt, got that curvature there. We got tension on the belt. Now, the next exercise is we're going to lift the heels off the ground. Okay? But when you lift out the heels off the ground, you want to use your muscles of the hip flexors to actually help out. Okay? So not just calves, but also the anterior part of your hip. So lift the heels up and then back down. Up and back down, just like so. Very good. All I want you to do is about 20 to 30 repetitions per set. Getting that lower half of the hip, of the body activated. Also making sure that our hip is stabilized by activating some of the hip flexors and the posterior side of the hip as well. And relax, okay? About 30 of those, all right? Last but not least, the third exercise right here. Same position, right? You're like, oh man, this is really getting those hip muscles really activated, especially the posterior side. We're gonna do the elbow curls, okay? Or elbow slides in Egoscue. So we got the tension on our fingers like this. This is called the golfer's grip. You're gonna put, Dr. Joe's gonna put that on his temple, right? So, still got anterior pelvic tilt, pressure on the belt. Now from here, he's going to bring his elbows to the front, try to touch the elbows, and then bring it back out, just like so. Now when you do this, try not to move your neck forward and back. Keep the neck as stable as possible, okay? From here, he's gonna do about 25 repetitions at a good pace. Very good. And keeping mobility of the shoulder, activating the back side of his posture, and in turn will help relieve some of that tension in the back of his head. So those three exercises, again, those are Egoscue exercises. I want to give a shout out to the folks at Egoscue. 3 exercises that uses a tension belt to help relieve some of the tension in your head, in your brain, in your head,
in your brain,
activating the posterior side of your body with actual exercises and movement with a little bit of stress there. But those exercises should not be painful, okay, when you do them. If anything, you will feel muscle tension and activation. And at the end, after the exercises are done and you get up, you should actually feel pretty upright, right?
Yeah.
Posture feels good?
I feel pretty good, yeah.
And walk around the room, let that kind of sit in and feel the muscles of the pressure of your head relieve.
Remember that this is more of a chain reaction, a chain that we're trying to make changes throughout the whole body rather than just going to the source of the pain.
Yes.
Source of the pain is the neck and the head, and yes, we understand you guys have a headache, but the body works together as a unit. They work together in patterns. So the more you work the patterns, the better you're off with your movement patterns later on.
Yep.
And your headache pain should go away. Let us know how we did in the comments below. Let us know how you did in the comments below. Let us know if there's any relief, if you feel better, and if you do, make sure that you guys share these exercises with anybody that you know deals with chronic tension headaches. We want to decrease your stress, we want to decrease that tension. Of course, there's a lot more things that we can do, but try these exercises first and see how they help you out.
Yep.
Thanks for joining us, guys. We'll see you guys in the next video.